Hello, and welcome to Psych Waves, where we review emerging and current holistic treatments in psychiatry while learning to understand the workings of our own minds. I'm your host, Dr. Teresa Anderson, owner and practicing psychiatrist of the Anderson Clinic in Cincinnati, Ohio. Today, I want to talk about all of the invisible walls that keep so many people from finding relief, from truly living their best lives, the fear of getting help because of the label. My community outreach coordinator, Gina, and I had a very interesting encounter at a recent veterans event. As many of you know, one of my passions is working with folks who are suffering with PTSD, which is a very common problem among our veterans. Well, we had a table set up among a multitude of vendors and office representatives at a local convention center, had a sign up sheet where people could leave their name, phone number, email if they desired more information about the services and what the clinic provides. We also had pamphlets, cards, posters about the services we offered, the typical spiel. People were initially friendly and respectful and asked questions about what we do. Then, as soon as they found out we were in the mental health field, they didn't care what we were offering. They dropped our pamphlets like hot potatoes and backed away slowly as if we were going to chase them down and put them into straitjackets. For the rest of the day, it was the same thing. We had maybe two out of hundreds of people there interested in what we had to say once we told them we were in the mental health field. Then the rest of the folks treated us kind of like we were contagious. What in the actual hell? This wouldn't be the first time I've encountered stigma, but it was certainly the most in your face one. I know I've heard it countless times at my practice at the Anderson Clinic. I think I might be depressed, but I don't want a label. Or I can't tell anyone about my anxiety attacks because they'll think I'm crazy. Or if I get diagnosed with bipolar disorder, that's it. My life's totally over. This fear, this belief that a diagnosis is a death sentence is like a permanent scarlet letter is one of the most powerful barriers to healing. But here's the truth, and it's the truth I want you to etch into your mind today. A label in the hands of a skilled professional is not a judgment or a limitation, it's a roadmap, it's a key. It's the beginning of understanding, not the end of your life. It's a tool for effective treatment, not a sentence or permanent doom. My goal today is to help you to break free from this powerful self imposed stigma and understand why getting help for whatever you're struggling with is absolutely the most courageous step you could take. First and foremost, let's talk about the fear of the label. Your fear of any mental health label isn't actually rational for what it's worth. It's actually a product of decades, even centuries of societal misunderstandings, misrepresentation, and genuine discrimination around mental illness. I mean, for God's sake, there were entire decades that women were put away in sanitariums if they were deemed to be hysterical or even if they had sexual intercourse outside of wedlock. Silence actually proved to be an important safety measure. We've been taught to view mental health conditions as moral failings or character flaws rather than treatable health conditions. Your brain is a part of your body just as much as your heart or your lungs are. And the last time I checked, you couldn't exactly talk yourself out of an arrhythmia or force your lungs to exchange more oxygen just because you gave it a pep talk. You internalize that societal judgment, and then it turns into a self imposed stigma, which can keep you from seeking out the help you so desperately need. And I get it. I mean, it's understandable to be afraid. Movies portray mental illness in extreme ways. Historically, there was profound shame. One Flew Over the Cuckoo's Nest, what comes to mind? But that's outdated and inaccurate. There are hundreds of thousands of people in the general population living with struggles you would be completely unaware of unless you truly knew them. Are every single one of those folks doomed? So many of us feel as if to be diagnosed with mental illness is tantamount to a death sentence. Why does it feel so permanent? Because we equate mental health labels with a fixed identity rather than a dynamic state. It's like believing a diagnosis of diabetes means you'll always be sick and unable to live a fulfilled life and maybe never even have a sweet treat again, which positively is not true if managed effectively. The true death sentence isn't in the label. It's the unchecked suffering. It's the years lost to depression, the relationships fractured by anxiety, the potential unfulfilled life because you were too afraid to acknowledge what was happening inside. That's the real permanence, the prolonged pain of untreated illness when you were too afraid to share it with somebody that might have been able to help. If you've been suffering long enough, perhaps you've tried to understand your symptoms by yourself. You've Googled, you've gone down the WebMD and Reddit rabbit hole, you've tried to just snap out of it. You've read all the self-help books and attended all the gurus' workshops. You've tried to talk yourself into positive affirmations. You tried to manifest. You went completely organic. You're exercising and getting sunshine every day. However, while self-awareness is great, trying to manage complex conditions without expert guidance is kind of like trying to attempt to do brain surgery on yourself. Potentially disastrous. I want to challenge you just for a moment. I want you to ignore the word diagnosis. Just focus instead on the pain that you're experiencing. Is that pain worth keeping it secret out of fear of a word or a label? And consider the actual cost of not getting help right now. It could get worse. You could lose your income stream, your job, your career, your friends, your relationships. You could potentially lose everything, including your life. And for what it's worth, do your friends or loved ones or coworkers really give a crap about what you call the issue? Or do they care more about actually getting their person back? Professional diagnosis isn't about boxing you in. It's actually about setting you free. It's about precision. If you had a persistent cough, you wouldn't just say, I have a cough forever. You'd want to know if it's allergies or bronchitis or pneumonia or cancer, because each one requires a different, very specific treatment. Mental health issues are no different. A diagnosis just provides a framework. It helps your clinician understand what is happening, not who you are. See the difference? It's an issue you've not understood to be your identity. It's not an identity you're saddled with. It's the difference between I have depression versus I am a depressed person. The diagnosis guides treatment plans, whether that's specific therapy modalities, different types of medications, lifestyle changes, lab workups, or a combination thereof. Without the diagnosis, treatment is often a shot in the dark. Frequently, what we see in patients when receiving a diagnosis, there's often a feeling of relief. Oh my gosh, it has a name. It's not just me. I'm not making it up. I'm not crazy. Other people experience this, and there are ways I can feel better. It can be so profound to know that you're not alone in experiencing this, that you are seen as a human being and not an illness, that you're not judged, and that your clinician has seen, diagnosed, and treated a number of people in your boat. It's also important to recognize that many mental health conditions are episodic. Depression lifts. Anxiety can be managed. PTSD symptoms can remit and your nervous system can calm down. Even chronic conditions like bipolar disorder are highly manageable with the right tools and support. Think of it like managing a chronic physical condition. It requires ongoing care, sometimes office visits, sometimes a change of meds, but it doesn't define your entire existence. Much like the diabetic, yes, you have to watch your carbs, but no, you're not required to live a carb-free existence. You have a life outside the diabetes. You will have a life outside your mental health diagnosis. As you heal, as your symptoms evolve and change and sometimes remit, so too might the clinical understanding of your experience. Labels are dynamic, they're not static. They are descriptors of a current mental state, not a life sentence. Imagine if your physical body is in pain, but you refuse to name the pain because you're afraid of what the doctor might say. Does that make the pain go away? Absolutely not. It actually prevents you from getting the right treatment. Could it get worse over time? Absolutely yes. Apply that same logic to your mind. What specific treatment might open up for you if you're actually willing to name the pain? The only way out of this cycle of fear and suffering is through it. And getting through it means taking the courageous step to admit that you need help and support and then actively seeking it. Waiting for it to magically disappear is a fantasy that fuels chronic suffering and may lead to the suffering of those around you who care about you as well. I'm going to ask you to be brave. and ask for the help that you need to get out of your pain. We all need help sometimes, and this is no different than having a sprained ankle. Why would you continue to walk on it without treating it appropriately? Recognize too that asking for help doesn't always mean medication first. It can mean therapy, working with a coach, joining a support group, journaling, meditating, seeing a psychiatrist for an evaluation, or even just having an honest conversation with a trusted friend or loved one. Start where you're comfortable. And as we discussed in my previous podcast on commonly misdiagnosed pairs, it could be that you have a physical ailment with a psychological symptom. Sometimes asking for help means you need a medical workup as well. I want you to focus on the outcome, not the diagnosis. Shift your focus from what label might I get to what relief can I find. Focus on the desire for less anxiety, more joy, better sleep, easier concentration, task completion, stronger relationships, a clearer mind. Those are the real goals. At the Anderson Clinic, our priority isn't to brand you with a label. Our priority is to understand your unique struggles, to listen deeply to your experience, and to use our expertise to build a personalized roadmap to your well-being. A diagnosis, if one is determined, is merely one piece of that very intricate puzzle, a guide for us to help you more effectively. We see the whole person, not just a set of symptoms. And you don't have to overhaul your entire life in one day. The courage is in the first step. Reaching out, making that phone call, scheduling that initial consultation. That single act breaks the chain of self-imposed stigma. So if you're listening right now and feeling the weight of an unnamed struggle, make a commitment to yourself today, right now. Take one concrete action towards getting help, whether it's looking up a therapist, scheduling a consultation with us, or telling one trusted person what you're going through. Take that single courageous step. Your future self is waiting for you on the other side of that fear. The decision to seek help is a profound act of self-love and courage. It's telling yourself my health and well-being matter more than societal judgments. Don't let the fear of a label define your life or limit your potential. At the Anderson Clinic, we're here to walk with you on this journey, providing compassionate, evidence-based care without judgment. Visit us at www.andersonclinic.net, or if you're in the Cincinnati area, call us at 513-321-1753 to take that courageous first step. Thank you for tuning into Psych Waves, and remember, your healing journey begins when you choose to illuminate what's been in the dark. See you next time.